So dense breast tissue is a totally normal thing that many women have, and it just refers to the normal fibroglandular tissue in the breast. But if you are a woman who has a lot of fibroglandular tissue, screening with routine mammography or even the new mammography digital breast tomosynthesis can be more difficult to find breast cancer. And that's because cancer appears white on a mammogram, it's an X-ray. And if you have that normal dense tissue kind of overlapping the cancer, can make it hard to pick it out on a mammogram. And so this has been known for many years, but I think it's only in recent studies that we've understood how many breast cancers are being missed. Because when we bring in other modalities that can find those cancers, we realize there's probably a reservoir of undetected cancer that is allowed to grow for many years before it can be detected by a mammogram. So our goal is to try to find that earlier so it's easier to treat and less likely to result in a breast cancer death. Right. So an MBI or a molecular breast imaging test is really a simple test. It's a nuclear medicine exam. So instead of looking at the anatomy of the breast, we are trying to probe it in a different way where we're trying to understand how the cells function. So we use a drug that has been around for many years. It's actually used in cardiac imaging. It's called sestimibie. But that drug is known to go to cells that are more mitotically active, which means they're kind of rapidly changing, dividing. They have increased blood flow. They're just more active than normal cells. So cancers will take up this drug a lot more than normal tissues will. So if you can administer it to a patient and then image that drug, which is what we do, um, in molecular breast imaging, we can see like a bright spot right where the cancer is. And it's not at all affected by breast density. So it's really a nice complement to a mammogram, which shows you the structures in the breast, but the MBI can come along and highlight that cancer. And that's what we found in our study is when we screened women who didn't particularly have high risk for breast cancer, but they had a history of dense breasts, and they were coming in for their routine screening with digital breast tomosynthesis. And when we added an MBI to that test, we detected 2.5 times as many invasive breast cancers in those women. So that was really striking to see how many more cancers were just not being detected by routine screening. Right. So we've been using MBI in our Mayo Clinic practice for over 15 years. But recently we've learned that it's most valuable as a supplemental screening technique. So women who have a mammogram are told they have dense breasts, and they're looking for maybe another option that can fill this gap of knowing maybe they're missing something, maybe they should have an additional test. And there are several good tests that are available, but we've found that an MBI can be pretty simple, and it can be something that maybe isn't as cumbersome or difficult to endure as perhaps like an MRI, which is a really great test and finds probably the most breast cancers of any test we have, but can be pretty complex. So we designed MBI to be kind of a simple test. And one of the strengths that we found is having it just be part of our breast imaging practice. So it's not often like a separate building in nuclear medicine, but having it be part of the breast imaging center. So we found that it's very convenient for patients to have their mammogram. And if they want an additional test, one of their options would be MBI as well. Yeah, so as far as our team in breast imaging, we are working on several modalities, but for MBI in particular, we're working on just making it an even easier test for patients to have. We found in a recent survey that almost all the patients that were surveyed, I think it was 97%, said that they would return for another MBI, so they like it. But we found that the test is just a little bit long. They're seated during the test. The breast isn't tightly compressed, but still you're kind of in this machine for 40 minutes. And we're trying to reduce the time that it takes to acquire those images. So we have some really promising results that we think are going to allow us to do that. And just trying to make it, just through interviews like this and publishing our research, we're just trying to make women aware that there are other modalities available that can really help solve some of the limitations of mammography. We still encourage getting a mammogram because it's proven beneficial. It still detects early breast cancer. But if you have dense breasts, you should probably consider having an additional test beyond mammography. One of the things that was really striking in our study that was just done in almost 3,000 women is that we found, yes, we detect additional cancers, and that's all cancers are important to find. But one of the things we're finding with these modalities that really probe the cellular function is that we are finding cancers that were missed on mammography, but they had really aggressive characteristics. So almost 70% of those additional cancers we detected were invasive, so very important to detect. And also 20% of those additional cancers we detected were called advanced cancers. So that means they were either over 2 centimeters in size, or they were node positive, or they had an aggressive molecular subtype, which just means that they're probably more lethal. So we were surprised at the cancers we were detecting that were being missed on mammography, because if we could find a way to detect those earlier, take those out of the mix, we could really make another important gain in reducing breast cancer death.